Welcome to DBS Pre-Op Education. We are going to review everything surrounding the hospital process for surgery. We will discuss how to prepare for surgery, what to expect the day of surgery and after surgery, and the discharge process. Celebration Health is a part of the Advent Health family. Advent Health is a Seventh-day Adventist facility and utilizes the principles of the creation model for healthcare. You will see and hear about these principles throughout your experience in our facility. Creation stands for choice, rest, environment, activity, trust, interpersonal relationships, outlook, and nutrition. It is important to discontinue use of any medication that increases the risk of bleeding for 14 days prior to surgery. These medications have been identified, and there is a more comprehensive list in your Deep Brain Stimulation Guidebook. If you experience any mild pain or headache within 1 week of surgery, the only approved over-the-counter pain medication to take is Tylenol, or the generic equivalent acetaminophen. Please be sure to ask if you are unsure about any medications to avoid prior to surgery. HybaCleanse is a medicated soap that kills germs that normally live on your skin, and its use has been shown to reduce the risk of surgical infection. HybaCleanse should be used in place of your regular soap or body wash and shampoo the night before or the morning of surgery, depending on when you take your shower. You should not use any lotions, creams, perfumes, or anything else before surgery. HybaCleanse is available over the counter at most pharmacies, including the outpatient pharmacy at Celebration, located on the first floor. Be sure that you have everything ready the night before surgery. Pack your bag for the hospital and leave all of your valuables at home. Please be sure you have your photo ID, your insurance card, and your prescription drug card if you have one. Also, please bring your home medications with you on the day of surgery. This is very important. Be sure you bring the medications in the bottles in case the hospital does not carry your medication. Do not bring a list only or bring them in a pill box. Take your pre-op shower using the HybaCleanse soap. Remember, once midnight hits, there is nothing to eat or drink. You may take certain medications as instructed with a small sip of water in the morning. But remember, do not take your Parkinson's medications. Your surgery arrival time will be provided to you by the physician office personnel the day before surgery. On the day of surgery, you can valet park in the front parking lot, or in one of the parking garages. The valet hours are from 7 a.m. until 6 p.m. Once you park, you will go directly up to the third floor and turn right. Follow along until you see the surgical check-in area and you will register there. Your family will wait for you there. In the surgical waiting area, there are televisions, phone chargers, and free Wi-Fi. There is also a cafeteria, gift shop, pharmacy, and vending machines available. Once you are in the pre-operative area, your nurse will take your home medications to get checked by pharmacy. This is important if we do not carry one of your Parkinson's medications so that you may take it after surgery. In pre-op, your nurse will start 1 to 2 IVs, prepare consent forms, and perform any necessary testing. You will also meet with the anesthesiologist at this time. Your surgeon will meet with you, and you will have the opportunity to ask any questions. You will have the head holder frame applied in pre-op, pictured here. You will then travel down to radiology for a pre-op CT scan. Once you return, you will then be wheeled into the operating room. The room may feel cold. The operating room staff will be completing their preparations for your surgery. A timeout will be completed where the team verifies your identity and procedure to be completed. There will be an area shaved on your head where the incision will be located. Surgery can take up to 3 hours. After surgery, you will go to the recovery area, and then after that, you will travel to the intensive care unit, ICU. You will be in the ICU step-down for an overnight observation. You will be in intensive care so that you may be closely monitored. ICU is located on the 3rd floor, neighborhood D, which is right across the hall from the surgical area. Visitors will be asked to remain in the waiting area while you are settled into your room. While you are in the ICU, you will be attached to a monitor and will have frequent assessments that will disrupt your sleep. You will have a CT scan very early the morning after surgery, around 5 a.m. ICU does have visiting hours, which they adhere to. They are variable, and you will be notified of them upon your arrival. Shift changes happen between 6 and 8 a.m. and again between 6 and 8 p.m. Your care team will be busy during this time ensuring a thorough report is given to provide you with the best care. Please note that family is not permitted to sleep in the ICU or the ICU waiting room. As part of our Creation Health philosophy, we want to be sure that we are meeting your spiritual needs. Therefore, you will also have the opportunity at any time to request a visit from the chaplain. The most important method to preventing the spread of infection is through hand washing. All patients, staff, and guests are expected to wash their hands. There are hand sanitizer dispensers located throughout the hospital, and each person to enter your room is expected to have cleaned their hands upon entering. Do not be afraid to speak up if you do not see them do so. In order to ensure that we are treating the right patient every time, our healthcare staff will ask you for your name and date of birth before administering any medications and tests. We know that this becomes cumbersome, but it is important. Please be sure that you are calling for assistance prior to getting out of bed. You may think you are feeling better than you are, and in a moment you could fall. Falling could injure you, and it is important to prevent that from happening. Call, don't fall. You will also be asked about your pain. You will have oral pain medications ordered, and there will be IV medications available if the oral medication is not keeping your pain, around a 3 or a 4 on the 1 to 10 pain scale. Keep in mind that you will experience discomfort, and our goal is to keep your pain tolerable. It is also important to take your oral pain medications with some food, even if it is just a package of saltines or graham crackers. We want to make sure that all patients know that it is encouraged for them to be an active participant and ask questions about their care if they do not fully understand what is taking place or if there are any concerns. There is a flat-screen television in every patient room that is equipped with internet access and the Get Well network. During your stay, the nursing staff will prescribe education for you to complete on this system during your stay. You may also utilize the Get Well network to communicate the effectiveness of your care team to the administration of the hospital. Your nurse will review all of your discharge paperwork with you. Please be sure to speak up if you have any questions. Plan to have your ride home ready to take you home at 10 a.m. As a convenience, our pharmacy here will fill medications to save you a stop on your way home. When it is time to get wheeled down, your ride should be waiting for you at the entrance of the hospital. This process helps to keep everything working like a well-oiled machine. In most cases, your wounds will be secured with staples and a bandage applied to cover them. You may remove the dressing after 2 days and leave the wound open to air. It is okay to get your incisions wet and soapy and wash your hair normally. Gently rub some shampoo onto the incision with the pads of your fingers. Do not scratch or scrub with your nails. Washing the incision daily helps to keep the area clean and prevent infection. The implant leads will be tunneled under your skin and no portion will be visible while you wait for the second procedure. During the second procedure, which is usually a week to 10 days later, the device is implanted and the leads are connected to it. The second procedure is an outpatient procedure and you will go home the same day. Although your implant is not turned on, you might feel like your symptoms are improved for a few days after surgery. This effect should wear off before your initial programming. You may experience some facial swelling after surgery. Sometimes this swelling occurs immediately, and sometimes it shows up a few days after surgery. Occasionally, it can be very severe and also cause the skin under your eyes to look bruised. This is normal. It will resolve on its own within a few days. However, sometimes it may take a week or more. It will continue to get better every day. Some things you can do to help it along are: spend more time standing upright rather than lying flat. Apply an ice pack. Take Tylenol if it becomes uncomfortable or painful. Once you get home, you may resume your normal activities as tolerated. Please refrain from lifting anything greater than 10 pounds for 30 days from your first surgery. Vigorous exercise for 30 days from your first surgery, including anything that increases your heart rate such as running. No tub baths, swimming, or hot tub use, and no driving for 2 to 4 weeks after your first surgery. The exact timing will be discussed at your follow-up visit. There are warning signs that will require you to call your surgeon. if you develop a fever above 101.5 Fahrenheit, if you experience any drainage from your incisions, or any new and concerning symptoms. Of course, you should also contact the surgeon's office if there are any questions that you may have.